afternoon, everyone. And I want to welcome you to our discussion today. It's just an amazing day. And just to give you a couple of minutes to come in, we want you to also contact just about everyone that is in your contacts that you possibly can contact, because the discussion is going to be very, very relevant, particularly for this amazing time that we are living in, where history is being rewritten every single day. We have this pregnant pause, and during this moment in history, when again history is being rewritten, we want to make sure that you are equipped and you are gaining the necessary information so that you can navigate this new terrain that we are living in. So we are asking you right now to call your family, your friends, and maybe do a watch party while we're here. And then, of course, it's always going to be available to you for you to listen to it over again once our discussion is over. So, good afternoon, everyone, and we welcome you today to our very, very relevant topic. And our topic today is the color of COVID, the health disparities amongst people of color. Health disparity is a huge discussion and a real concern around the world. And I'm not the only one having these discussions, but there are discussions that are going on right now, even as we speak around the world. And today we are talking with Dr. Paula Walker, who is a board certified public health physician, a preventive medicine specialist, and also an author. So today I welcome Dr. Paula Walker King. Thank you for coming.
Thank you for having me, Dr. Trimm. It's
Ab-
my pleasure.
Absolutely. I know that you are passionate about medicine and, in particular, preventive medicine. So, where did this passion actually get started?
When I was in medical school, I remember sitting in classes, and as we began to learn about the different chronic illnesses, they would talk about diabetes and diabetes, and they get to the epidemiology and they say, oh, diabetes, you see that more frequently in African Americans. And then they move along to talk about high blood pressure and then the epidemiology of that condition. Oh, we tend to see that more in African American communities. And then we move along to, the next disease. And, it was always more diseases, more health conditions being magnified and occurring with greater prevalence in African Americans. And so early on in my medical career, health disparities, doing research and taking a closer examination of these persistent health disparities. And when I say health disparities, I'm referring to differences in healthcare outcomes, differences in healthcare experiences that are preventable, they are avoidable, and largely they are unfair. And so it results in uneven outcomes for different members of our population.
Wow, wow. I think this is a very, very important discussion because you're talking about something that is preventable and then the outcomes of it based on the type of information that is received and healthcare that is given. And as we begin to explore the future of this brave new world,
Mhm.
what are the questions that we should be asking about health and healthcare?
Well, specifically as it relates to disparities, one of the questions is how do we begin to deal with the implicit biases of healthcare professionals that toward patients who are already vulnerable? So you're already dealing with individuals with some vulnerabilities. And so, how do we begin to deal with these implicit biases? How do we begin to teach cultural competence and cultural sensitivity so that we can better connect and better, minister health and healing and wellness to communities of color. Then we have to look at the healthcare system in and of itself. which we saw during this COVID-19 pandemic, was totally overwhelmed and underprepared. And so one of the questions as we face this brave new future is, how do we gird up our existing healthcare system? What are the necessary reforms that need to take place? What we have in place in terms of our system, the stress of the pandemic exposed all of the weak spots, the fissures and the fractures in the system. And so how do we begin to mend and build a better healthcare system that can serve all in an equitable manner?
Those are some very heavy questions, Dr. Walker. And I would like to just tackle one of them.
Uh-huh.
And, there is a brand, FUBU, for you,
Uh-huh.
by you, and
Yeah.
we're both women. And I
Uh-huh.
know tackling these questions and trying to find answers and the way forward is huge. So if we just now narrow it down just for this discussion, woman to woman, how do we tackle it as women? What can we do?
As women, number one, we just continue to blaze the trail as leaders. I think as women, so often we've looked for mentorship and it has not been there. We've looked for examples of how to create these solutions, even within the walls of our healthcare system. And so because the mentorship wasn't there and because the path hadn't already been blazed, we didn't give ourselves permission to go ahead and blaze the trail ourselves. And so we just really have to allow the natural creativity to problem solve, to allow that to flow, and to be willing to step into new leadership positions, whether we're invited to do so or not. Basically, we carry the answers, and so we have to be willing to let our voices be heard and let our persuasions be known. A lot of these problems that we're discussing on today, they're not necessarily new. They've been around for a while, and I know quite a few dynamic women, yourself included, that carry answers to a multitude of these problems. And we just need to, number one, embrace the calling that we are the problem solvers, and we don't have to have to have a previous example to consult before we do something new.
So fill in the blank, and from the perspective of the whole healthcare problems that we are confronted with, when a woman is empowered to, she will, and just fill in the blank.
When a woman is empowered to lead, she will take on new frontiers and she will create a brighter future for us all.
Wonderful. And you want to elaborate on that? Because I do realize that if you give a man a fish, we'll have a fish fry for a day. But if you give a woman a fish, she's going to not only provide for the family, but find a way to stretch it to provide it for the community.
Right. So I talk about that a lot in my book, Lead Well, that women really, they are the change agent that no one is really talking so much about, but we carry so much of the change. Because when you talk to a woman, say from a public health perspective, I do a lot of health education, and when I talk about nutrition to a woman, I know that she's going to take that nutritional information and make better dietary choices for herself. She's going to make better dietary choices for her children, and her spouse is also going to be the beneficiary of that information. So when I empower a woman, will instantly cause transformation in the lives of several others, including her family, as well as other members of the community. And so that's why I, target women as such dynamic trailblazers that just really need just greater avenues and pathways for self-expression.
Yeah, this is really, really good. And talking about women, the big question on the table are, why are African Americans being adversely affected in this climate, the current climate that we are in, particularly since we're dealing with the COVID-19. Why is there such adverse reactions and manifestations?
Well, when we first of all, when we look at the COVID-19 pandemic, we're looking at the confluence of the pandemic along with the epidemics of chronic illnesses that were already prevalent.
Yeah, and I don't want to I don't mean to interrupt you, but just for the average person, what does confluence mean?
Okay, got it. So you basically you have you got these two conditions stacked upon one another. So they're merging together. So we've got the pandemic, and it's a merger of the pandemic with the fact that we already had high blood pressure occurring in African American communities and epic proportions. We already had an epidemic of diabetes in African American communities. We already see asthma and obesity and other chronic illnesses in larger numbers and frequency within the African American community. So when you take a pandemic and stack it on top of epidemics, you have worse or poorer outcomes. And that's really what we're seeing.
And this is really, really good because I heard someone explain it this way, and I love it. If you are taking a prescription to fix the symptoms of any condition, then you are at a higher risk.
Right. So exactly, because when we talk about underlying illnesses, sometimes people don't connect the dots. And so if you take a pill for anything if you take a pill that has been prescribed to you by a doctor, that means that there's some underlying condition and some underlying vulnerability. And so you have to take every precaution during this pandemic so as not to leave yourself susceptible to developing this infection. This coronavirus that we're seeing, this novel coronavirus, is unlike any other virus that we've seen before. It has some very atypical characteristics. We were seeing that when it first started, we thought that it may demonstrate some seasonality, just like the flu virus. The flu virus comes every fall, and then by spring, we see a dampening of flu cases. But the coronavirus that causes the disease, COVID-19, started in the end of 2019, the fall to winter season, and is coasting right on through the spring. And so we're not even seeing a dampening of cases. And so we're concerned that it's going to, these cases of coronavirus are going to continue right into the fall, where we're going to have another round of this mutated flu virus that shows up. And then we'll see a surge in those flu virus cases among people. Yeah.
And I'm glad you used the word novel. And for those of you that have tuned in, novel simply means that the old procedures no longer work, or the old procedures are no longer applicable to something that is new. So that's very important, in the discussion.
It is. And because it is so new, that's why we did not have any type of treatment for it. We didn't have any medication or vaccine. The only treatment was supportive care. And that's why we were just, totally swamped and overwhelmed by the devastation that it caused in terms of wiping out so many people's lives early on in the pandemic, because we did not have the ventilators and that support, the ventilatory support, enough of that to save everyone that was afflicted by the illness. And so it's a very new illness. We're learning about it every day. We're seeing manifestations where it's even causing strokes in very young people. Somehow it causes the formation of these clots. And so we're seeing, the development of strokes and other untoward consequences. And so it's just going to take some time as we continue to see how this virus continues to perform and behave. And, we are still concerned about it possibly mutating and taking on yet some other set of characteristics.
Yeah, yeah, I can understand that.
Mm-hmm.
In addressing the whole idea of unequal access to healthcare, one of the things that you talked about is having to address health disparities,
Yeah,
but the undertow of the increased COVID-19 mortality um,
right,
among people of color, particularly African Americans. Do you
right.
want to elaborate on that?
Yeah, so when it comes to some of the vulnerabilities, number one, when we look at the fact, okay, yes, there is the higher number of cases of underlying illness among African Americans, but then also in terms of being essential workers. We think about the idea of social distancing. That is the number one way that you prevent community spread and decrease your chances of contracting the virus. But when you are an essential worker, you don't. You have to go to work. You don't have the luxury of social distancing. And we have a lot of African Americans and members of our Hispanic community that are essential workers. And so they can't call out, they can't stay home, they can't socially distance. And on that note, when it comes to social distancing, and this is the health disparities part, because, when we think about being able to telework, stay at home, and earn an income, it's a matter of privilege. Everyone doesn't have that opportunity or that privilege to be able to telework and work from home. If you're a police officer, how do you do that work from home? If you're a transit worker or a bus driver, how do you do that work from home? And so when you have these essential positions that are occupied by African Americans, then just by reason of going to work every day, they are, increasing the frequency of exposures to the coronavirus, and not in the same position as other members of the population to socially distance and telework and avoid these exposures.
Yeah, I like to say that you treat it like a mass murderer being let
Yeah,
loose in your neighborhood.
yeah,
Everyone would be taking precautions, not just those that are frontline workers, those that are working from their home, even. They'll take extra precautions.
right.
And even as our communities are opening up and the economy is opening up and jobs, people are returning back to their jobs, still take the precautions.
That's right.
Don't go out without taking the necessary precautions.
That's right.
And, in particular, I really want to talk about women. We have observed some interesting mortality rates among women. And I know I was talking to an OBGYN from New York City, and
Hmm.
there are many, many women in childbirth
Hmm.
that are passing away or dying, and leaving many of these children orphaned. But what have you observed about the mortality rate amongst women?
Well, when we look at maternal mortality is worse and heightened in among African American women. And the interesting thing about this maternal mortality rate among African American women is that it doesn't matter socioeconomic status. So with some of these health disparities, if you're poor or you live in poverty, the worse the outcomes for all of these chronic illnesses. But in this particular case, it doesn't matter how affluent African American woman is. It doesn't matter how much education she has attained. Her mortality is still heightened if she's pregnant and she delivers a baby within the U.S. healthcare system, and it's one of the worst in the world among industrialized nations. And we can trace that back to the fact that some of the implicit biases. We saw it with Serena Williams. Serena Williams, when she had her daughter, she came out as a very vocal advocate to stop and stave, turn the tide on these heightened maternal mortality rates in African Americans. What she experienced during her pregnancy and delivery is that she was having shortness of breath, and she was complaining to the doctors, telling them that she was, something wasn't right, that she wasn't, feeling well. And they continued to ignore her. She continued to press the point and ended up having a blood clot in her lungs, what we call a pulmonary embolus. Judge Hatchett, for those of you who may know Judge Hatchett, her daughter-in-law died at a very prominent hospital, Cedars-Sinai Hospital out in Los Angeles. And basically she had she had a cesarean section, and she had hemorrhage. She was hemorrhaging, and she kept complaining. Her husband kept complaining, and they tried to get the attention of nurses and doctors and say, hey, something's not right. She's in pain. It's not getting better. And by the time they rushed her back to the OR, her abdomen was filled with blood, and she died on the OR table. And so somehow these complaints that are made by African American mothers, they're not taken as seriously as if they were made by women from other racial and ethnic groups. And so we know that if a Caucasian mother who just delivered, she's complaining of belly pain, most of the time is taken more seriously and is at least investigated. If Serena Williams, we could hypothesize that if she were a woman of another race, if she complained of shortness of breath, she would have at least gotten a chest x-ray, and they would have checked her oxygen saturation levels. And so these are things that are yet concerning. And that's why I mentioned the implicit biases of health professionals, doctors, and how they operate toward patients who already have underlying vulnerabilities. And so we do have to look at these areas of medicine that are uncomely. There's a wonderful book that is on the subject that was authored by the Institute of Medicine, Unequal Care. And so it's been researched, it's been heavily researched and documented. And so we know that, these differences in experiences and differences in outcomes do exist, and they've been quite persistent.
And we talk about equal rights, but we want equal care as well.
Yes. And so quality of care and access to care. I do a lot of work with rural areas, and so all care is not even. So even when we look at just one single state, what the care that is available in the city or the urban areas is quite different and more sophisticated than what's available in the rural areas of a state. I was just recently doing a lecture with some students, and it was interesting because we're looking at Atlanta. And for those of you who are familiar with Atlanta, we're looking at Buckhead, which is a very affluent area of Atlanta. And then we looked at Bankhead, just a few miles away. And so what we know in healthcare, and we see this in public health science alike, that your health outcomes, in terms of your lifespan, all of that can be traced back to your zip code. And so Buckhead, the life expectancy right now is 84 years of age. When we look at Bankhead, where there is lower socioeconomic status or more poverty, fewer resources, more dense with fast food restaurants. So it's classified as a food desert because we don't have a real grocery store. You don't have as many grocery stores or Whole Foods, so to speak. And so you have all these fast food restaurants. You have a Burger King on one corner, McDonald's on another, KFC on the other. And so a food desert, not enough healthy options. And so when you have a food desert like this, you look at 84 years being the lifespan in Buckhead, affluent area. Go to Bankhead, just a few miles away, different zip code, and the lifespan is 71, right?
Wow, wow, wow.
That many years is shaved off of the lifespan. So I think it's very telling when your health outcomes and your health status can be traced to your zip code. That shouldn't be the case. Health equity, yeah.
Yeah, yeah. I know that we can really go deep, deep into the subject. I'm looking forward to other conversations that we're going to have and dialogues that we'll have so that we could drill down. Uh,
Right.
but Dr. Walker King, you're talking about these problems that cause disparities or the disparities that are there, and they're being highlighted in
Yeah.
the midst of this pandemic. So looking at mitigation,
Yeah.
and then eventually eradication, but at
Mhm.
least with the mitigation, how can we avoid the second wave, because it is already predicted to be worse than this first? And how can we prevent the second wave from hitting African Americans even harder? How can we avoid this?
Great question, Dr. Trimm. So, first of all, I don't know that we can avoid the second wave. The nature of viruses is that they tend to mutate. When we look at coronaviruses, it's a family of over 300 so viruses. This just happens to be one of them. And the nature of them, they tend to mutate. So, there is talk about COVID 2020, even while we're still dealing with COVID 19. So there is a second wave coming, and how to, you know, um, avoid that wave. We have
Lessen, mitigate the hitting of it in the
got it.
African American communities, and the hitting of it even harder. How can we mitigate that?
Well, the main thing, how we can mitigate it is, first of all, we must take this pandemic, the fact that the
Yeah,
environment we live in, is very seriously.
yeah.
We can no longer think it's a hoax. We can no longer think that it won't happen to us and that we're somehow invincible. We must take the measures, these public health measures very seriously. Continue to socially distance, regardless of what the governors of your states say. The governors of your state say the nail salon should be open, and the barber shop should be open, and the malls should be open, the beaches should be open. But here's the deal: when you gather, there is the greater increased chance of the virus being spread and you becoming ill. So we must continue to wear our mask. This should not be something we have to force upon individuals. We have to wear a mask if you
It's
go
not
out.
an option.
It's not an
Yeah,
option.
it's a necessity.
It is absolutely a necessity. You've
Mhm.
got to wear your mask. You've got to wash your hands and keep if your hands are unwashed, keep them away from your eyes, your
Which is
nose.
a difficult thing to do,
It's a very difficult
because
thing.
you naturally, I want to, since you said eyes, I want to rub my eyes automatically.
Yeah.
That means that we do have to continue to practice hygiene. Just, making sure your hands are clean, making sure you carry with yourself little small bottles of the hand sanitizers,
Yeah.
and also with your children, to make sure that, because children put their hands all over, they rub their hands on surfaces,
Oh, it's so
they
difficult.
touch everything. So,
Hmm.
as mothers, to make sure that you're keeping your children extra clean, their hands, the surfaces, things like that, and protect your children. Make sure that you explain to them, give them an awareness, and make sure that your children are protected, and practice social distancing. This is with everybody. So
This is
don't
with
don't
everybody.
think just because you have a friend that you could trust your friend more than a stranger.
Mm-mm.
And because the virus sometimes is asymptomatic, there might be people that are carrying the virus that have no symptoms, that may infect you. So being extra precautionary is important.
It's important. And I would add one more thing as a mitigation measure: strengthening the immune system. So there are foods that we can eat to keep our immune system strong, because guess what? We our immune systems are quite able to fight the coronavirus and other infections. However, what happens is because we're a stressed out nation, we are not necessarily eating as well as we should. We're not exercising as often as we should. Our immune systems tend to suffer. And when the immune system is compromised, or as some would say, the resistance is low, then it allows for infection to be established. And so keep your immune system healthy. So where you can, stay physically active, move your body 30 minutes a day on most days of the week. Just doing that, it gives a boost to the immune system. It causes the immune system to function with greater zest and vitality. So you want to do that for yourselves. Yeah. Make sure you're staying hydrated. Make sure you're eating foods that are whole foods and freshly prepared foods. Those have immune strengthening characteristics. Yams, especially richly colored foods. So sweet potatoes or yams, rich in vitamin A, which strengthens the immune system. Zinc is another immune system supporter. Vitamin C is a big immune system supporter. So it's not all doom and gloom. There are things that we can do that are within our ability to control.
Fresh lemonade.
Fresh lemons. Oh my gosh, lemons are
low sugar, but people who don't like the acidic taste, put a little sugar, make some fresh lemonades. But buy lemons, drink lemon juice first thing in the morning, hot water and lemon, a whole squeezed lemon. That's good. Elderberry, sea moss. Get outside in the sunlight. And if you're inside, then take vitamin D. Order some vitamin D.
That's right.
Put your happy music on.
That's right.
Raise your emotional health. Put happy music on, whatever your happy music is. Dance because you're moving. So make sure every night you're moving, dancing. Those of you that have a Fitbit or your watch, you can monitor your steps. Try to get 5,000 to 10,000 steps in every day, and you could do that. House cleaning, dancing.
That's right.
There are things that you can do. I tell people, look, if you cannot get to the gym and you have carpet at home, instead of vacuuming, sweep, because you'll be able to use your muscles, your arms. There are things that we can do. And then YouTube has everything there. I mean, 7-minute workouts. I was looking at a 7-minute workout today. There are 7-minute workouts, 10-minute workouts if you cannot get to the gym.
Exactly.
So, there are things that you can do. And again, what is important, try to eat as close to Mother Nature as you possibly can. Eat a salad. When you go to the grocery store, make sure you are wearing your masks when you go to the grocery store. And do not drive in the car with your mask. But when you get out, put that mask on and go to the grocery store. And if people are not avoiding you, you avoid people. Because there are some people that when they shop unconsciously. They're forgetting all the social distancing protocol. So you should be conscious about that as well.
Totally. You summed it up. We have to keep our bodies as healthy and as well as possible. And it serves as a great defense against the coronavirus and any illness for that matter. And so you hit the nail on the head, Dr. Trimm. And then also, just on the note of the mask, these single-use gloves that people are wearing, I don't know if you've seen them out with the gloves on.
Yeah.
Really, those gloves, they're supposed to be used for a single use. So, for example, if you have a package arriving from Amazon, reach out, grab the package with the gloves on, open your package.
Throw them away.
And then throw them away. But I've seen people shopping with the same gloves. They didn't pump gas at the gas station. Now they're in the grocery store, touching their canned goods and whatever they're buying with these same dirty gloves. And so I just wanted to throw
that glove use. And that's the same. If people are making your food, demand that they change the gloves.
Amen.
You know,
Amen.
yeah,
Yep.
just demand that they change the gloves. I know if I very seldom go out, but when I do, if I see someone before me, in the checkout line, and then I come to the checkout line, I
Mhm.
demand before they touch anything, please take those gloves off and put a new set of gloves on.
You got
So, and the same thing in, if you're going to a restaurant, and you have someone serving you, before you drive up, just let them know, if you have those gloves on, please take the gloves off, and you could demand that they make you a fresh bunch, and you can
that's
watch
right.
them. So there are things that you should do. Take your health care into your own hands.
That's the greatest defense. Take your healthcare into your own hands, right
Mhm.
there.
Mhm.
I think sometimes we relegate too much power to the healthcare system and those that are within it. But you are the greatest champion for your own health and well-being.
Yeah.
So uh, you have to take your health seriously and do everything to guard against and protect it.
And a part of that is not just hydrating and eating nutritiously dense food, fresh food, things like that, keeping the
Mhm.
counters clean, and practicing social distancing. One of the things that people forget is sleep.
Oh, yes, very much so. And sleep is your immune system is not going to function optimally without sleep. So you have to find ways. Either you're going to embed a nap into your day, so you're going to have to put a nap somewhere into the day, or you're going to have to get to bed earlier to secure enough sleep, because we should have 8 hours of sleep per night. But if you can't have 8 hours of sleep per night, then at least make sure that you're getting at least 6 hours.
And the way to do that is put those phones down. Put
Yes.
those phones, have a time, and I want to make this as practical as I possibly can. My
Uh-huh.
phone turns off automatically, and you can program it
Uh-huh.
at 10 o'clock at night. It will
Mhm.
not ring until 7 o'clock in the morning. And
Mhm.
so that's number one. And I set that purposely. And then number two, not only put on auto, for your phone to automatically turn off notifications as well as ringing, unless of course you're expecting an emergency call. And if there's an
Right.
emergency call for anyone, they have to call my house. And if someone calls my house and it's not an emergency call, then I correct them. Do not ever call my house phone unless it's an emergency call. That's number one.
Mhm.
And
Right.
then the second thing is to make sure that you turn your bedroom into a dream room. So leave the technological devices outside of your bedroom so that you are not tempted to answer the phone, to surf the net, to hang out on YouTube until 2 and 3 o'clock in the morning. And it's undermining not only your sleep and your rest, it's undermining your immune system.
Right. Absolutely. And so sleep is so vital. It's a vital ingredient to having a healthy immune system. And so can't say enough about that. Please do what you can to rest. And in getting your rest for your body, rest your mind. And so again, turning those cell phones off, demonstrating what we could have call good sleep hygiene. All ambient lights, getting rid of those, making sure you're not even supposed to be reading in bed. Just making sure that the sleep experience is one that going to be tranquil and rejuvenating, and whatever that calls for, whether it's a nice warm bath prior to a cup of tea, chamomile tea, make it a soothing and relaxing experience, and amp up the sleep hygiene so that it can be a place where your body and your mind are fully restored and recharged.
Yeah, this is good information.
Yeah.
So what would you suggest should be doing now, right now? We've talked about self-care, uh, mental care, health care. Is there anything else you would suggest that we do now?
For the healthcare system at large, I know that there's going to be a lot in terms of the debriefing after this pandemic. I think that in terms of how doctors and healthcare workers have been treated during the pandemic, they didn't know proper PPE, personal protective equipment. We're going to have to look at how we deal with resources in the healthcare system. Look at the rights of healthcare providers, and some healthcare providers, they were fired for speaking out for lack of PPE. So we have to look at how we treat our members of our healthcare system. How do we garner resources for our healthcare system so that we are prepared should there be another pandemic? And then as far as preparedness at the national level, the CDC and the NIH, but primarily the CDC, and how do we, deal with crises such as COVID? We have to look at how we launch our preparedness efforts, and how we, those task force are formed, and what are we doing in the meantime? When there isn't a pandemic, that's really when we should be strengthening our networks, and so that we should never see another. Hopefully, if there is another wave, hopefully will never be as bad as what we've seen with COVID-19 because of the lack of preparedness. And so preparedness is going to be huge. Compassion, empathy. I'm hoping that with COVID-19 is put a spotlight on existing health disparities. And it is my prayer and hope that we will emerge with a greater resolve to look at, some of the social determinants of these healthcare outcomes, and what policies can be put in place governmentally that would create more even care and work toward health equity for all.
Wonderful. Well, you know what, Dr. Walker King, you actually ended on a note that I was going to lead us into the discussion off, and that is, what do you see your vision for humanity moving forth? And you summed it up in those two words, health equity.
Yes.
And if those of you that are listening to us, you're tuning in and listening to Dr. Paula Walker King, and just a brilliant medical mind, and a gift to us today. And if you have any questions that you would like to ask, please give us your name, where you're from, ask the questions just before we sign off. And then if there's any other subject matter that you would love for us to engage in as we address world issues, and I call it the Human Project, because that's what we're involved in right now. You can feel free to connect with us on Facebook. You can DM us. You can send us a message for some of the topics that you would like for us to address. And I have to get a little closer to the screen. But please ask your questions. Yes, if you have any questions, everyone is saying thank you, Dr. Paula. Great discussion. Thank you, Dr. Cindy Trimm, and you're very, very welcome. And everybody's sending their thanks. And if you have any questions or comments that you would like to make, I'm noticing your comments, please do. And you're very, very welcome. And people are just saying thank you and wow, and it's a difference. If it affects both men and women equally. So the question on the table, Dr. King, does the coronavirus, does it affect both men and women equally?
It does. And so we haven't seen any gender disparity as it relates to COVID-19. And so both men and women are equally susceptible to the development of the disease. Interesting. I was reading an article, and it was showing.
This is just a temporary disconnection. We're not too sure what happened, but we do see your questions coming in. And as soon as she returns, then I'm going to ask her. But it's been a pleasure to do life with all of you. and to provide just a platform for you to hear the kinds of discussions that are going on in the world, and give you an opportunity for even you to weigh in by giving your comments and even asking questions. But as we provide the kind of platform that would maybe help you to rethink life and to rethink this whole uh, being human and what being human really means. And Dr. Walker King is back. She was answering that question. Go ahead, Dr.
Yeah, so I just wanted to say that, again, that just speaks to what we can do. So since men and women are equally affected, we know that if we control our weight, that actually, obesity is one of the highest risk factors for the making us susceptible. So we can control our weight. And so use this time while you're socially distancing to be physically active and watch what you're eating. But I just want to,
good.
yeah,
There's people that ask questions, doctor. One is a question of, what if I want to give blood? Is that still safe? And then the second question is a question about children. How do we prepare when the schools open? How do we prepare to send our children back to school? One is giving blood, and the other is a question of sending our children back to school and help with the prevention in that area.
All right. And so when someone has the coronavirus, if they're actively infected, we will, if they test COVID positive, then they are to self-quarantine for 14 days. And as long as they're within that 14-day period, they're not donating any blood. But once they have been cured, or they've recovered from the virus, and they have at least two negative tests, subsequent negative tests, then they would be free to be able to donate blood, subsequently thereafter. But they have to get through the infection, and they have to have at least be tested subsequently at least 2 times, and those results need to be negative before we can definitively say that they are candidates for blood donation. As for children, I agree that this is, it's a precarious spot that parents are in. I have a 5-year-old, and I'm concerned about him, and now homeschooling seems even more of a viable option and something that may need to be pursued because I don't know. The school district hasn't made a decision as to what they're going to do in terms of whether the schools will be open business as usual come fall. We just don't know. And so we're going to have to just, what I have heard is that they're going to make the classrooms where they're going to limit the number of students that can be in a classroom.
Wow.
And so it would be less than 10 students in a classroom. So they're going to do some social distancing measures. They're going to, ramp up disinfection, for the schools and really start to teach our little ones how to be, more mindful about their hand hygiene and not touching their eyes, nose, and mouth, and these portals of entry where infections, microorganisms would otherwise enter the body. And so it's a new reality. And so we'll just have to stay tuned to see how that looks. But for the most part, social distancing and reducing the number of students in classrooms and in cafeterias. Students won't eat lunches in cafeterias. They would eat lunches within their classroom. So if there are 6 to 8 students in a classroom, they would stay there and eat their lunches. And so these are some of the modifications that are on the table.
Thank you so much. Dr. Paula Walker King, thank you for being a part of this discussion, the color of COVID, health disparities amongst people of color. And it's been a wonderful discussion and a very, very helpful discussion. And thank you once again for being a part of just bringing information to equip us so that we can live healthier and better lives in moving forward. Thank you once again, guys, for tuning in. And in the meantime, know that our prayers are with you and your family. Stay healthy, stay happy, and stay safe. God bless you, and goodbye for now.